Good day. We are looking at the large intestine. Here we're going to have a look at the large intestine. So this is abdomen, large intestine, and this is small intestine, jejunum, ileum. So to have a look at clearly at the large intestine, we need to remove the other organs first. Okay, remove the liver, stomach, and the jejunum, ileum. So we can see that here is the cecum, here is the appendix. Appendix here you can see it is posterior to the terminal ileum. This is terminal ileum. You can see appendix is posterior to terminal ileum. So that's position of the appendix is retroileal, also called as postileal. Okay, again cecum, terminal ileum, and here ascending colon, up here right colic flexure or hepatic flexure. This is transverse colon, left colic flexure, down here descending colon, sigmoid colon. Rectum is down there, so cannot be seen. Okay, so here we can see tinea coli. This is free tinea. This is omental tinea, and this is free tinea. You can see transverse colon have a mesocolon, transverse mesocolon. So let's remove this transverse colon. Here you can see the arteries and veins of the large intestine. We are not going to have a look at this. We are not going to have a look at the arteries in this model because it's not 100% correct. So let's remove the large intestine and let's have a look at the structures posterior to it, its relations. Posterior to the cecum is the psoas major muscle, iliacus muscle, gonadal vessels, posterior to ascending colon, quadratus lumborum, transversus abdominis muscle, kidney, same as on this side. Posterior relations of the descending colon, kidney, left kidney here, psoas major muscle, iliacus muscle, quadratus lumborum muscle, transversus abdominis muscle. Okay, that's all for large intestine. Thank you.